What are the signs and symptoms of an inflamed plica on the inside of your knee? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Plica injuries and plica problems aren't that common. I think it's a lot of sort of a default explanation of somebody's pain. I don't think there's that many people that deal with an inflamed plica, but if you are one of the ones that have it, it can be really aggravating. In this Ask Dr. Geier video, we're going to talk about plica syndrome and what the signs and symptoms might be. Alright, Harry asks, a band on the medial side of my knee pulls on the inside of my kneecap when I roll over it. It's constantly inflamed and causes pain. Could this be a symptom of plica syndrome? Well, it sounds like it could be. What that is, just so you know, is in a small percentage of the population, it's hard to say, maybe 5%, and a lot of those people don't have any knowledge that they have a plica or that it's inflamed, but they have a plica in there. But you can have a band of tissue that runs sort of from the inside of your kneecap over to the front or inside of your thigh bones, inside the knee. Now again, a lot of people have that and have no trouble with it. But in a small percentage of the population, it can get inflamed and aggravated and cause a lot of pain. And you may have discomfort right in that area. You may actually feel a thick band of tissue, so when you kind of put your finger on it, you can roll over it, it can be really aggravating. Something else you might feel is if you're running or cycling, something with a lot of repetitive knee bending, you can actually feel a snapping sensation. Now fortunately, a lot of times you can overcome this without any surgery. Maybe some anti-inflammatories, occasionally a cortisone shot directly into the plica, sometimes physical therapy. A lot of times just rest and time gets it better. On rare occasions, you can go in and scope the knee. If nothing else is working, scope the knee and take a shaver and just basically take that plica out. And that works really well a lot of the time if that's the cause of the pain. I think that's the challenge. Is that plica truly the cause of your pain? But if it is, that can do well. But that surgery does take some time to get over. You know, the knee swells a lot. You have to work to get your motion and strength back. Patients have told me, especially those that have had surgery from somebody else, because rarely do I feel like there's a need to do that surgery, but if the ones that have had it tell me it may have been 3 or 4 months before they really felt normal. So it's not just, hey, just go in and take out the plica and you're good as new. It takes a long time to get over that. The key is to find a doctor, an orthopedic surgeon, and truly figure out if a plica really is the cause of your knee pain. Okay, have you had a plica issue, plica pain, plica syndrome, even had plica surgery? What kind of symptoms did you have? What was the treatment suggested? And how did you get over it? I'd love to hear your experience. In the comments below this video, describe it. Tell us all about it. I'd love to read it, and I bet viewers all around the world would as well. I can't answer questions that you leave in those comments, but again, I'd like to understand what you're dealing with. Now, in the description below this video, at the very top, there's a link to a page where you can tell me, you can answer 4 or 5 very simple questions. Takes less than a minute. But if you answer those questions, it can help me understand your injury and help me give you the #1 thing that you need to know to understand and overcome your knee injury. I think it's really helpful. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record several of these videos every single week, so click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. If you're dealing with a plica, I hope this was helpful. I look forward to seeing you right here next time.